My name is Faustina Mensah. I'm a Master's of Nursing student at Colorado State University, doing my Master's in Nursing with emphasis in education. This presentation is on 1-minute presenter method. It's a partial fulfillment of the oral comprehensive examination. My PICO question is, in an instructional strategy course, does the use of the 1-minute presenter method compared to traditional methods improve clinical teaching skills among nurse preceptors over 10-week student clinical rotation? So one may ask, what is the 1-minute presenter method? This is an evidence-based method of standardizing communication between the preceptor and the preceptee, and the aim is to improve preceptor's ability to teach. This method is a brief teaching tool. It's been used in medicine, in nursing, in dentistry, and it's able to assess a student's knowledge as well as provide a timely feedback to the student. So what does this process of 1-minute presentation involved? So there is a need to get a commitment. So once the student comes to me as an educator, I need to find out what's going on. The student should be able to tell me, based on the signs and symptoms of the case, that this patient has bipolar. Then there should be a probing of whatever is going on. So we need to probe for support. Here, the student will tell me, I need to find out, okay, what kind of bipolar? Does this patient has bipolar 1 or bipolar 2? And the student will then come out and say, based on the fact that this patient has a manic episode, the patient has bipolar 2. Then the third process is to reinforce what was done well. Then I'll come out and say, well done, you've been able to identify that this patient has a manic episode. Once this patient has a manic episode, then we are dealing with bipolar 2. And then I'll give guidance. The student might have made an error by saying, well, this is bipolar type 2. And then I'll come and say, no, this is not bipolar 2, it's bipolar 1 because the patient has a manic episode. Then I'll teach a general principle that bipolar, this patient is not sleeping well. This patient has a manic episode, so at least we know that there is a bipolar diagnosis here, and this is not schizophrenia or another diagnosis, and then we'll conclude that. Now, the significance of the problem is that nurse preceptors are key stakeholders in shaping incoming nurse practice. Preceptors are expected to assist nursing students with transitioning to their role to facilitate the clinical experience. There is also a universal need for a more diverse education with regard to improving the clinical teaching approaches for the preceptors. Also, as part of the problem, there is a lack of standardized preceptor training programs that embrace evidence-based methods of training in support of teaching principles. So the goal here is that the 1-minute presenter method is going to help standardize the teaching process to help the preceptor to impact knowledge to the preceptee. There is also a practice concern that, if not addressed, has the potential to result in nurse preceptors that do not possess the right skills to adequately train incoming nurses. And this is where the 1-minute presenter method comes in, to really equip the preceptor to be able to teach effectively whatever needs to be taught to the nursing students. And there is also the perception that there is frustration with lack of role development has a direct correlation with the future intent to practice in this role. So that if the preceptor is not able to really teach and educate the students well, they get frustrated and they are not able to practice. The dissatisfaction in the role is perpetuated by unclear expectations of the teacher. The 1-minute presenter method comes in to help the the preceptor to be in line, to be able to teach exactly what he or she is expected to teach. And at the end of the day, the students benefit considerably. There is also decline in nurse preceptors. There is decline in nurse preceptors, and it's projected to cause financial loss to many organizations. The lack of this preceptors does affect the number of nurses that can be trained in a given period of time, and this has drastic financial loss to many organizations. Using a traditional model of preceptor training can be ineffective and frustrating, as we've already said. There is also evidence that traditional preceptor training can be enhanced by offering additional strategies. So even when we are using the traditional method of teaching, we can still incorporate the 1 minute preceptor method to make the teaching experience more effectively. So this is the case study. GL is a 35-year-old female preceptor who has been precepting nursing students in a nursing college for 1 year. She read about the 1 minute preceptor in the nursing peer review article and decided to implement this method while precepting 6 mental health students in their precepting. She decided to use a traditional method during the first week of clinicals and the 1 minute presenter method the second week of clinicals, and compare her students' perceptions of her teaching skills for both weeks. She decided to continue the rest of the clinical time with a method that best improves her teaching skills and facilitates learning and communication with the preceptors. This is a practice guideline, and it's an international affairs and best practice guideline. This practice guideline provides nursing preceptors with the goal is to provide nursing preceptors with a structured participatory professional development and education program. At the same time, it helps implement in collaboration with the service agency, and that includes information about teaching strategies and theory, information about addressing student clinical goals, objectives, scope of practice, and unsafe practices. According to this practice guidelines, there should be specific guidelines on implementing a standardized approach to role modeling as a clinical teaching strategy. So this is where the 1 minute practice guideline comes in, that this is very specific and it's standardized. We have a process, 6 processes that needs to be followed, and that way the preceptor is able to really teach the students what needs to be taught. And the importance of an orientation meeting with the student for establishing trusting, continuous relationship and mutual expectations for the experience. So this is the evidence table. I have so many people, so many authors, and the evidence is really clear that the 1 minute preceptor method does affect teaching in a positive way. For Aika, Lickott, and Rudy, the key finding was lack of adequate preceptor training, with evaluating preceptor performance and providing feedback was reported when the general teaching method was used. And with Gatswade and Grain, the 1 minute preceptor the finding was that it's an effective teaching model and preferred by students, and it increases teaching technique and also giving feedback to students at the same time. There were some gaps in evidence. There is respondents bias, and the sample size was somewhat small. If we are able to get a bigger sample size, it's going to help us come out with better findings. So the theory for this process is the Malcolm-Knowles Adult Learning Theory, which provides a theoretical framework for this project. According to this theory, adult learning principles become widely acknowledged when in response to research that differentiates the needs of the adult learner, requiring a democratic style of learning rather than authoritarian style of learning. The theory defines preceptors are both clinicians and educators. So as educators, preceptors facilitate learning through meeting specific orientation goals of the preceptee. Knowles' theory supports that promoting diversity with learning experience, such as including the 1-minute presenter method into the preceptor training, serves to engage many factors into the adult learning style. So application of this theory is really key, and it's recommended that preceptor adapts their teaching style based upon learner's needs, which are central tenets of this theory. So the implication for nursing education in healthcare. The 1-minute presenter method training program has been substantiated by the evidence as a strategy to improve preceptor teaching, increasing confidence and competence in the role. So it equips the preceptor to teach and to deliver exactly what is expected to be delivered. It is a smart method of helping both the preceptor and also the preceptee, because the preceptee is able to find out in summary what needs to be done, and that way knowledge is attained. It also opens up a necessary dialogue among nurse leaders by standardizing the training and nursing as a profession that standardized process from having its own language. So this is a follow-up of the case study. At the end of the 2-week period, GL found out that she was able to gain insight into the student's clinical reasoning and identify the evidence, and that she was able to do better with the 1-minute preceptor method compared to the traditional method, and she decided to go on with the 1-minute preceptor method. So this is a summary. Development of preceptor teaching style ensures competent performance at the bedside. Lack of support with development of the role of the preceptor is an important source of frustration, and this project attempts to provide a solution. The solution is the 1-minute presenter method, where the preceptor is able to teach effectively and the preceptee is able to understand and able to apply whatever it's taught in the clinical setting. Malcolm's Knowles Adult Learning Theory provides the theoretical framework for this project, and it applies to both the intervention and also to the population. Knowles Adult Learning Theory aligns with a humanistic approach to knowledge acquisition, being centered upon the person as capable of self-motivation and self-direction. The 1-minute preceptor method is supported by the literature. It's evidence-based and it's able to result in effective teaching. That's the end of the presentation. Thank you.